Hi, I'm Dr. Paul Ruff at West End Plastic Surgery, and I'm here with my compatriots, Erica Chafin, who is our moderator and host, and Dr. Justin Cohen, who is our facial plastic surgeon and my partner in crime in the office. And we're really happy today to have Dr. Imran Siddiqui at the Regenerative and Orthopedic Sports Medicine Group. I've known Imran for quite some time. We've done a number of really fascinating things together. My interest in this world came through some of our interest in some coordinated therapy, stem cells, some cutting edge things, really, not to use a surgical term, cutting edge. But Dr. Siddiqui's been with ROSM for 5 years. He is Harvard trained, went to Jefferson Medical School. He's got an amazingly thought-provoking, forward-thinking spirit, and has just been a pleasure to work with. So we wanted to introduce him to you all. So Imran, I want you to tell me a little bit about what PM&R is. I mean, I know what it is, and I know the benefit that it has. And I think we hear about, like in the sports world, the Kobe Bryants, to use somebody and we all know, or others who have benefited from this. But what really is it? I mean, how would you describe it to someone who has no idea what this is?
Right. Well, thank you so much for having me in the introduction. Just want to say it's been wonderful. I met Dr. Ruff and have been working with his practice ever since I moved here from Boston 5 years ago. And it's been amazing to work with such a wonderful group who really serves the community well. So I just want to say thank you for having me first. So PM&R stands for Physical Medicine and Rehabilitation, and that is what I did my residency in. And it's actually a relatively broad specialty. With the overall goal is PM&R doctors are doctors of function. So our overarching goal is to improve patients' function so that they can do what they want to do and they can optimize what they can do in the community. And my subspecialty, now there are multiple subspecialties. There's brain injury medicine, so PM&R doctors who take care of people with concussions and severe brain injuries. There's spinal cord injury. There's a neurologic portion of it that focuses mostly on strokes and other neurodegenerative disorders. But my focus is sports medicine and musculoskeletal and orthopedic conditions. And so my whole goal is to keep my patients as functional as possible. So for most of my patients, that's making sure that they can do the exercises that they want to perform, that they can run if they want to run, that they can bike if they want to bike, if they want to play sports. So that is my overarching goal. Now under that, there's multiple different ways that we improve people's function, and the most important way is through proper diagnosis. And so what we do here at Regenerative Orthopedics and Sports Medicine is we're all certified in musculoskeletal ultrasound, and that has been a big portion of my extra learning and ultimately now teaching is musculoskeletal ultrasound. So we're able to get a proper diagnosis in the actual visit, where we can perform an ultrasound on, say, the knee if it's injured, and determine if they have a meniscus tear, or is it a ligament sprain, or is it arthritis. And that way we can skip the steps of the MRI and get to a diagnosis. So that's the most important thing. And then now what things are going towards in terms of therapies are, a lot of people are not wanting to do surgery as much. And also, there are more and more studies coming out about certain arthroscopic surgeries having long-term detrimental effects. And so they're looking for more of these regenerative therapies to try and heal these injuries on their own, rather than reconstructing a ligament or cutting out a portion of the meniscus, or sewing together a rotator cuff. And so we've been getting pretty incredible results with these, and there's a wide range of therapies that we use for that. The most common therapy we use is platelet-rich plasma, which is also used in the cosmetic field. There's a platelet-rich plasma facial, and for hair loss as well is now being used for. And then also other more potent cellular therapies that we do, adipose grafts and bone marrow grafts that are full. These grafts are full of stem cells, and they have more potential for healing.
So, you know, you hit on something early on that I think is one of the things that I've always been impressed with. It is the use of ultrasound, because we know that there are a lot of physicians in various specialties who will say, well, I do this, I do that, I inject. And even early on in my training, before ultrasound guided use was more commonplace, you feel a couple things, you push that needle through, you'd hear pop, pop, and like, okay, I'm in the right spot. And you could be somewhere close, you could be nowhere close.
Right.
And I really have always been impressed with not only that you all use ultrasound, but how proficient, because musculoskeletal ultrasound of the soft tissues is, I think, quite difficult, right?
Absolutely. It took me 3 to 4 years of consistent training in this to become what I think as proficient enough to be able to do everything that I want to be able to do with ultrasound. And I'm still learning. I mean, we still learn. One of the greatest things about teaching ultrasound is I get to go hang out with the other teachers and learn more tidbits here and there. But it is the cornerstone to our practice, and it is the cornerstone to anybody who would be performing these regenerative therapies on the musculoskeletal system, because studies show that you cannot, no matter how good you are, no matter how much experience you have, you cannot be accurate with doing injections without image guidance. A study compared 5 seasoned orthopedic surgeons who were doing joint injections without ultrasound guidance, and compared it to a brand new intern who got a 1-month training on ultrasound on how to do these injections. And the intern just kind of completely destroyed the seasoned orthopedic surgeons on accuracy of their injections, because the orthopedic surgeons they didn't have the use of ultrasound. So it's vital to be getting these regenerative therapies in the proper place. So that is extremely important. And then, as I talked about, the diagnostic portion, because you don't know how often patients in the musculoskeletal system will be misdiagnosed, and they'll get a treatment on the wrong structure. And so we work very diligently and very hard to make sure that we're not missing that we're diagnosing the right issue, but also making sure we aren't missing any other ancillary problems around that major injury that are also causing problems as well.
Yeah, I've always been amazed at the, for those who know how to do it, the precision of ultrasound sometimes, in fact, frequently trumps MRI and others, because you get real-time view, and they can be dynamic as well as static. So, yeah, I once again, I find it amazing. We try and continually incorporate it. I know you've been to the office to help me progress my very rudimentary skill level in ultrasound, but definitely see the tremendous value in that. So I think that's, it's one of the things I've loved about the practice, I will tell you.
Yeah, thank you.
I wanted to ask you, so you touched on something very near and dear to my heart, with hair loss and kind of cosmetic treatments with the stem cell therapy. So, while you're enjoying your COVID hair, I just wake up every morning and just be thankful that I have some hair. So it's a little bit of
you're doing a pretty good job there.
Tricks of the webcam, I think. So we do a ton of that here in terms of just regenerative medicine for hair loss and other kinds of stuff. But let's say I also had some knee ache. Talk me through a little bit about how your procedure works. What are the kind of the logistics of having a procedure done with, say, a fat derived regenerative method? Could someone foreseeably come in and see us for a PRP maybe enhanced with nanofat or something treatment for the hair, and
Right.
kill two birds with one stone. Can I just sit in one chair, have somebody work on my knee ache,
Right.
repair some of my hair changes? Is that something that's foreseeable, or are we just, is that never going to
No,
be?
I think that's the dream, right? I think that's the goal here is how to right?
Yeah.
How do we bring this to fields? Because right now we do micronized adipose treatments for various conditions. We mostly use it for larger full thickness tendon tears that where platelet-rich plasma is just not enough, and you need a structural scaffold with those adipocytes with embedded parasites, which are the stem cell that's in adipose tissue. And so we use it for these larger tears, and we also use it for knee arthritis. There are many studies coming out on the incredible effects of micronized adipose for knee arthritis. And then we can extrapolate that to obviously every other joint. But right now I'm doing, Dr. Ruff was kind enough to train me in how to do lipoaspiration. And I like to think I've worked hard at honing my skill, but I will never be as good at aspirating adipose as you guys will. And I tell my patients there will be absolutely no contouring. There's none of that going on. I'm purely taking the adipose for your cells so that we can get them to your knee. But if we can do both together, if we can, take the adipose out, you can contour at the same time, you can, put extra in the face and or wherever it may be, or in the hair, and then also, hey, they say, listen, I've had this, torn elbow tendon for the last 4 years, or I have knee arthritis, and someone from our practice can come in and do that portion all in one stone, save the patient's money, be able to get a comprehensive treatment. I think that's the dream right there.
Yeah, that would be absolutely amazing.
Yeah.
And
So, I would agree.
Oh, so
I would agree. That is the dream.
Who would you say benefits from this? Like someone like me, who I spend majority of my day at this desk. I'm not playing sports.
Right.
Once in a while, am I someone who would benefit from this? How would I know if I am?
So almost pretty much every single person that comes in our office has some kind of injury, but it doesn't have to be sports related. I mean, sitting at a desk it takes a toll on our musculoskeletal system. It atrophies our hip muscles, more likely to have knee problems, obviously neck issues from being in this position all the time, wrist issues, elbow problems. They now call what they used to call tennis elbow, they call it mouse elbow now, because it's more common in computer users than tennis players. And really what that is tearing of your tendons on the outside of the elbow. So pretty much anyone who has a musculoskeletal ache or pain is a candidate for, and I strongly suggest they come in and see someone someone who does musculoskeletal ultrasound, so they can come in, get a proper diagnosis, and then we can go from there. I have to say that most mild injuries, we diagnose it on musculoskeletal ultrasound. We usually send them to physical therapy, and that's usually enough. But many of them, many people who come have already tried physical therapy, or their injury is more severe, and then we have to jump to the regenerative therapies.
Yeah, I don't think there's a single person that we don't see that if I ask the question, and that's probably, partly, our, downside is we don't ask that exact question is, have you noticed any changes in your joints or your hips or things like that? Because I would bet you, given the demographic age-wise of patients that we see for these body contouring procedures, probably 60 to 70% of them have issues that would truly benefit. We always call, fat liquid gold. It has so many properties. It's one's own cells. I mean, there's nothing better than that. And when we can use that in a therapeutic way rather than throw it in the trash, everybody benefits.
Absolutely. Yeah. It's It's been amazing. Adipose has been being used more consistently over the last 5 years in the musculoskeletal world, and the research is building and building and building. And we've just been getting really incredible results. I mean, we're saving people from knee replacements. We're saving people from total shoulder reconstruction, and also saving people from or we actually have a therapy for some conditions that don't have a good surgical option as well. So for some people who have no option other than pain meds or opiates, we're able to help them as well. So it's been the last 5 years, regenerative medicine has really taken off in orthopedics, and it just continues to grow. It's a very exciting time.
It is. So one final question just in my mind. Do you think it's just the pericytes, or do you think there's some other endocrinologic effect from the fat, and especially the fat that survives? Right. I mean, I think of fat as more of an endocrine organ rather than just a spacer or some inert tissue in our body. I feel like we really don't fully understand what fat totally does. Right. And what do you in the PM&R world attribute to the success of fat relative to other options like PRP, bone marrow, that sort of thing?
Right. Well, I mean, you hit it on the head when you said we don't fully understand, and it would be naive for me to say that, oh, the pericytes are the end all be all. We are learning so much on a daily basis, and at least in our practice and the other leaders in the field, we look toward the basic scientists, the PhDs, as to what is really going on there. And Arnold Kaplan is the guy who kind of coined the name mesenchymal stem cell, which is the specific type of stem cell that grows muscles and tendons and bone. And so he's kind of who I follow and who most in this field do. And so we feel that the pericytes are a big part of it. And so a lot of people, getting into the nitty gritty of stem cells. So, the initial thought of what a stem cell is, it's a precursor cell that can grow or turn into whatever tissue or a few different types of tissue that the body needs it turned into. So mesenchymal stem cell, they used to think that it turns into bone, muscle, tendon, nerve, ligament, right? But what we're finding is that these pericytes, which are stem cells that line microscopic blood vessels, and adipose so happens to have a very high concentration of those microscopic blood vessels, so it has a high concentration of these pericytes, that they more are signaling cells rather than actually turning into the cell that we want them to become. They are signaling the damaged tissue to regenerate. They're signaling other cells to turn into bone or tendon or whatever we want it to turn into. And it is more of a paracrine endocrine process rather than a simply, this stem cell turning into another cell. And what we know from a paracrine effect is that it is a complex, multifaceted, multicellular process, that it's not just these pericytes doing the work. It has to be other cells. And what the interesting thing is that in the United States, you can't do this, but in other countries, what they do is they'll take the adipose cells and then extract the mesenchymal stem cells, and they'll grow them in a petri dish, and then to try and increase the amount of stem cells there are. And then after they've grown for a month, they'll implant them back in. And what head-to-head studies have, and at least in animal models so far, they've shown that there is no benefit, and actually maybe not as good of effects if you grow those stem cells in isolation and then put them in, whereas if you just take the adipose directly from the patient, put it back in the same day without increasing the cell counts. And so what that tells us is you need these cells to be intact and in their normal environment with the adipocytes, with the other structural tissue, with all these other ancillary cells in order to work properly.
Fantastic. Well, I think it is such a growth area of medicine. It's like I said, we do a lot of body contouring or using fat grafting for various things, hair restoration. facial rejuvenation. We use PRP as well. If you all in the world out there start hearing myself or Dr. Cohen ask about joint issues in the midst of your body contouring or your facial consult, don't be surprised, because we now have options to help multiple things in one procedure, which is quite nice. And
Right.
Imran, I want to say thank you for joining us today. I know we're going to have a couple of more of these chats to expand on this conversation. It's an exciting area. It's one that we want to continue to be part of and grow that science, as well as utilize that science for the benefit of our patients. So like I said, for those of you who are listening to this, don't be surprised if that question comes up. It's nice that we have solutions. So Dr. Siddiqui, thank you so much for joining us today. If you all want to learn more about Dr. Siddiqui, please visit their website at www.rosm.org. That's www.rosm.org. And for Dr. Cohen and Erica and all of us at West End Plastic Surgery, thank you for joining us. And we look forward to seeing you on another Zoom chat in the near future. Take care.
Thank you so much for having me.